now. Okay, so I'm going to get us started by going through. So our objectives for today's webinar is to familiarize attendees with the public benefits available to survivors of DV and SA, introduce current political climate's effects on access to public benefits, establish an understanding of resources available for further learning on public benefits, and most of all, our speakers want this to be an opportunity for folks to be able to issue spot when you're filling out public benefits. So to start us off, if folks can please put in the chat box, what public benefits do you support your clients in accessing? And if you all can write that in your chat box, we'll be able to start that process. Okay, so we have food stamps coming in. And this is just to give us kind of a warm reading on what people usually access for their clients. Awesome. DTA, food stamps, SSI, SSDI. So this will be perfect to learn more. Awesome. SNAP, SSDI, WIC, SSI. That's awesome. Very cool. Thank you all for sharing. So we're going to get started with Lisbeth, who's going to be going into DTA cash assistance and welfare. Lisbeth, thank you so much for helping us out with this.
Yeah, it's my pleasure. So hi, everyone. My name is Lisbeth. I work at Greater Boston Legal Services in the Welfare Law Unit, where we do legal representation of clients regarding DTA issues, some childcare issues, and then systemic advocacy to try to improve the system for everyone. Ayanna, I'm getting a message that says I'm muted. Can you hear me? Okay. Just to give you an overview, we're going to go through what the DTA benefits are. So that's transitional aid to families with dependent children, or TAFDC, emergency aid to the elderly, disabled, and children, which is EAEDC. And then I'm going to try to talk about some protections related to domestic violence and sexual assault, how you can help in referring clients to legal services. So I'm covering DTA's cash programs today. I'm not going to go into substance on food stamps. I know a couple of people said they work with food stamps, but the pieces that are about protections and how you can help and referring clients to legal services will certainly apply to the food stamp cases as well. Okay. Ayanna, were we going to do the poll now? Okay. So this is a poll that will just help me if you could quickly answer the poll questions about the most common problems that you see with DTA benefits. And you could pick more than one, I think, or you may only be, yeah, okay, you can pick more than one. So verification issues where clients can't provide what DTA is asking them to verify, missed appointments that cause problems, problems with the TFDC work program requirement, TFDC child support requirements, problems because you can't reach DTA by phone, and then other if there's something that you could fill into the chat box that would be helpful.
Awesome. Yeah. So far we're getting quite a few folks who are participating, and I'll be sharing these results as soon as we get about half of the folks who have answered.
Okay. So maybe I'll just keep going in the meantime.
Yeah, that sounds
okay. Great. So I'm going to start by talking about the TAFDC program. Again, that's the cash assistance program in Massachusetts. People refer to it as welfare. And it's a program for low-income families with children and pregnant women. And the entity that runs it in Massachusetts is called the Department of Transitional Assistance, or DTA.
And so we just got the polling results.
Okay.
So people should be able to see it now, but it seems like the ones that are most likely are can't reach the DTA caseworker by phone, verification issues, and then missed appointment is another one of the top ones.
Okay. All right. Thank you. That's helpful. It's also entirely consistent with what we hear from our clients and the providers who refer cases to us. So not surprising to me at all. So I'll try to cover at least something on verification issues, and maybe we'll have time to squeeze in something about what to do if you can't reach a caseworker, because that's a pretty big barrier, of course. Okay, so in terms of just the basics, who's eligible for TAFDC. So this is a program for families with dependent children. So there's a child under the age of 18, or there's a child who's 18 and is expected to graduate from high school by the age of 19. And that child is, or children are being cared for by a parent or another relative caretaker. So it doesn't have to be a parent, it could be an aunt or a grandparent, cousin, any of those things, okay? And then the other category of people who are eligible for TFDC is pregnant women. For teens, that can be any time in the pregnancy. For women who are not teens, it is age 20 and up and within 120 days of the due date. So more limited than it is for teens. And then of course, this is a program that's needs-based. It's based on being very low income, so you have to be financially eligible also. And in considering your eligibility, DTA will look at income, like what money you have coming in, both earned and unearned income. And then they're going to look at assets. How much does this family have in assets that are countable, okay? The financial eligibility rules are really complex, so I'm not going to go into detail there, okay? So the most important thing to know about the TFDC program is that there are a lot of rules for folks who are getting TAFDC. And why that matters is that if you don't meet a rule, then DTA may impose a sanction that either lowers or stops your TAFDC. And that means stop it for the whole family, okay? And the thing that we like to stress is that there are a lot of important exceptions to those rules that can protect against sanctions and losing TAFDC, and including ones that are specific to domestic violence and sexual assault. So I'm going to go through those in a little bit, but I always like to stress to people that there are exceptions. DTA unfortunately doesn't always do a great job about telling people about those exceptions. So that's an important role that advocates can play, is knowing those and being able to have a little flag go off in your mind that says, ooh, this might be a situation where that exception applies or where an exception applies, okay? So I'm going to talk now about the key rules that relate to domestic violence and sexual assault. There's many, many other DTA rules and TAFDC rules, but this is what I'm going to try to focus on now. The first rule is called the family cap rule. This is a rule that says, it came along with welfare reform in the 1990s, and that says that once a family receives TAFDC, if there are subsequent children who are born more than 10 months after the family first gets TAFDC, the family doesn't get any additional TAFDC for those children who are born later. And so what that means is that the monthly grant amount for the family isn't based on the number of people in the household once those children are born, it's based on what it used to be. And so the family is trying to take care of more children with the same amount of money, okay? And the key thing that is important to know with respect to domestic violence and sexual assault is that there are some very important exceptions to the family cap rule, including one that says that if the child is conceived as a result of rape, sexual assault in the context of domestic violence, or where there's incest, then the parent can ask for an exception to the family cap rule. And that is really critical for folks to know about. You know, we see some people who understand that they have a right to do this and they request the exception on their own, but we also see some people who come to us and years after the child is born, you know, they might come to us for something else, but we take a look and we say, well, what about this? And then we realize that they could have had, you know, they could have been eligible for an exception for that child all along and been getting an increased grant amount for that child. One thing to note, that a question we often get, so even if a child is subject to the family cap rule, that child can still get food stamps, WIC, childcare benefits, all of those things. So that's not a, you know, it only affects the TAFDC, okay? Another key rule that relates to domestic violence and sexual assault is child support requirements. Anna, can you back up? I'm still going through the bullets. Yeah, thank you. So for child support, and this is one that I think scares a lot of people away from applying for TAFDC, because I think people sort of know the word that if I sign up for TAFDC, I'm going to have to do something about child support. And that is correct. If you sign up for TAFDC, the parent who's applying for the benefit has to talk to DTA about the child support and assign to the state the right to seek child support for any child who's getting TAFDC. What assign means is basically you sign a piece of paper that gives the state the right to go after child support on your behalf. However, the important exception that applies here is that if it's not safe to go after child support because of domestic violence or sexual assault in the past, the parent can ask for something called good cause for non-cooperation with child support requirements. And that's really critical for people to know about, because being scared about child support shouldn't be a reason that the family can't get TAFDC, because there are very clear exceptions for this. Another set of rules that have implications around domestic violence and sexual assault has to do with the TAFDC time limit and work program requirement, and then what's called an exemption, which means an exception from those rules. So the general rule when you're getting TAFDC is that you are subject to a time limit, which is a limit on how long you can get benefits for, and a work requirement, which says that you have to do a work activity for a certain number of hours every week with some exceptions. And some of the exceptions include what's called an exemption, which takes you out from under both of those rules while you have the exemption. And there are two kinds that are relevant here. One is a disability exemption, and the other is a caretaker exemption. And the reason that they can be relevant is that people who have experienced domestic violence and sexual assault often have long-lasting effects, including things like post-traumatic stress disorder, depression, anxiety. And if that is the case for somebody who's subject to the time limit and the work requirement, it may mean that it's not realistic for them to meet that work requirement on a consistent basis, or it may mean that they need more time on TAFDC. And that can apply both to the parent, or if the child has issues as a result of domestic violence, it can apply to the child as well. And that comes in the form of what's called a caretaker exemption, which means that the parent is saying, I can't meet this work program requirement because my child's needs are so extensive that it prevents me from working full time. So those are the two key exemptions that we see relevant in a lot of situations where our clients have some kind of a trauma history. And then finally, another key rule is the domestic violence waiver. That's sort of a catch-all that DTA has that says that if you can't meet a TAFDC rule because of domestic violence, either now or in the past, we may waive certain rules for you. And so that's something also to keep in mind if none of these other things provide the protection or relief that the client needs. Okay, so next, I wanted to talk a little bit about what you need to do to prove domestic violence or sexual assault in order to get one of these protections, because that's something that comes up a lot with our clients. Some clients have sort of official third-party verification of the domestic violence, like a court document, a restraining order, a police report, a medical record, something like that. But many people don't have those things. They never felt comfortable going to any outside third party, and so they don't have anything like that. So they worry the DTA is kind of going to either deny them or try to force them to get those things. So DTA cannot require what form the verification comes in. They are going to want some proof of what happened if a person is asserting a protection, but they can't require that it be specifically a restraining order or specifically a police report, something like that. And in most cases, DTA will accept a statement from the survivor, which is called a self-declaration, together with a statement from someone else that they told about what happened. And that someone else doesn't have to be a professional. It could be their mom or their aunt or their friend who is willing to write a statement and say, this person told me that this happened. And it doesn't have to be super detailed. It can be at a pretty high level. I've helped many clients write these, and you don't have to, share too many personal details. You just have to go broad enough to paint the general picture of what was happening. I will say that to DTA's credit, I haven't seen them reject these when we've helped clients do them. So certainly if you are seeing problems with that, we would love to hear about it. But in our experience, that's not really a big problem. Okay, so I'm going to move on now to the other cash assistance program, and I apologize I'm going so fast, but we have a lot of ground to cover today. So EAEDC is the other cash assistance program in Massachusetts, also administered by DTA, and this one, really the way to think about it is this is for people who can't get TAFDC, and so it moving on, it covers specific categories of people who might be eligible. Ayana, can we move to the next slide? Thank you. Okay, so this one has like more buckets of people who are eligible. So elderly people age 65 or older, people with a disability, someone who's caring for a household member who's disabled, and then finally there's like a small group of children and caretakers who might be eligible for this benefit. And these are families, or these are situations where people are not related or they're very distantly related, and so they don't qualify for TAFDC because they don't meet the relationship requirement in the TAFDC program. And then like the TFDC program, you have to be financially eligible. They look at income and assets, okay? So for this program, there's, as you see, a much shorter list of what rules are really eligible. For the EAEDC program, it doesn't have all the same rules that TAFDC has, so it doesn't have like a work requirement and other things that make all those protections necessary. So really the key thing here is if you are qualifying for EAEDC based on disability, there is a disability determination process that people have to go through. And that involves, first of all, telling the department what your disabilities are and writing it all down on a very long form, and getting a doctor to sign off and say, yes, this person has a disability. And then it goes through a longer review process, but you can get benefits while that process is playing out. So I think the connection here, again, is recognizing that a lot of survivors who've experienced trauma from domestic violence or sexual assault have very long-lasting effects of that. And sometimes those effects rise to the level that they may be eligible for a disability-based benefit. So that's why I'm raising it here in this context. Okay, so now I'm going to kind of step back and try to talk about some of the issues that come up and protections that are available across all of the DTA programs. So for TAFDC, EAEDC, and for food stamps, this is relevant too. So one thing that's good to know is that clients of DTA can ask for extra security on their DTA case file if they have concern that someone's going to try to access information about them or try to pretend to be them and cause problems for them. So there's kind of two ways to do that. One way is to ask DTA to put what they refer to as the DV flag on the case. This is also referred to as heightened level of security. And if a client does this, the consequence is that they cannot then speak to DTA about their case by telephone, whether that's through the automated system or calling directly to their caseworker. Even if their caseworker recognizes their voice, they're really not supposed to talk to them at that point. So it's a pretty restrictive protection. And for some people, they really need to assess whether it actually increases safety or not, because the consequence of that is that it means people have to be going to the DTA office more. And if they're going to the DTA office in an area where it's not safe, then that is something to assess. You can also request to move to another DTA office, of course, but I just say that because limiting phone contact doesn't always make people safer. And so in addition to this DV flag that appears on the computer screen and restricts phone access, you can also separately restrict access to information through any of DTA's automated systems. So now they have interactive voice telephone system where you call in and it says press 1 for this and press 2 for this, and you can get lots of automated information just by entering the social security number and year of birth. So clients can cut off access to that so that somebody cannot call and get information about them that way. And that also cuts off access through DTA's mobile app, which is called DTA Connect, as well as they have a new kind of web-based version of DTA Connect that you can use to log in and get some information about your benefits. So you can prohibit access to all of those things. And I should note, if you put the DV flag on your case where you're restricted from talking to a person over the phone, it will automatically apply those automated protections as well. So those are the levels of security that are available for a DTA case. And then another issue that comes up a lot is verifications. And I gather from the poll at the beginning that a lot of folks are seeing problems with that. So one specific way this comes up in relation to DV is if clients don't have requested verifications because they've fled an abusive situation and they've left lots of their documents behind. Or, even if it didn't just happen, but that's, they left the documents behind and they've been homeless for a long time and moving around from place to place. So some of the things to be aware of there is that in some situations, if the client has made every effort to get a document and can't, or it's not safe to even try to get it, then DTA may accept a statement from the client about whatever it is that they're trying to verify. And again, that's called a self-declaration. And the other really important thing to know here is that DTA workers have a duty to help get the verifications. If somebody asks them, they are actually required by the regulations to help. Unfortunately, we don't see that affirmatively offered a lot, but it is something that they're supposed to do. And then the other thing I just wanted to note here, since folks said they have a lot of verification issues, is that recently DTA did a pretty major overhaul of its system to try to improve the way that verifications are requested, and specifically to try to cut down on what we call over-verification, which means asking for things they shouldn't be asked for, either because it was already provided or because it really shouldn't be requested in the first place. And DTA has done a pretty major overhaul of their system to try to program it to not allow things to be asked for when they shouldn't ask for them. That said, nothing's ever going to be perfect, and I'm sure we're going to continue to see some level of over-verification, but we hope that it's going to be improving at least step by step as time goes on from when they implemented those changes. They're still pretty new, and they're still ironing out some of the kinks that came up there, okay? So another protection that's relevant across the DTA programs is this concept called good cause. And what that means is, essentially, if you have a good reason that you can't do something, you can't meet a rule or a requirement that DTA has, something they're asking you to do, if there's a good, compelling reason, you can assert good cause. So an example of that might be you miss an appointment because your kid was sick, or because it conflicted with a weekly therapy appointment, or any of those things. And that really applies across a lot of DTA rules and programs. So it's always something to be aware of if the client has a good reason for not doing something that was asked of her, and these other higher level protections don't apply. Good cause is always a good fallback to consider. Okay. And then one other thing that I wanted to mention that applies across all the programs is that DTA has a special role called DV specialists in the DTA offices. Hopefully some of you are familiar with them. There's often one DV specialist that covers a region, so that person might rotate between offices in a certain region. Their role is to both be a support person to the DTA regular caseworkers who might have questions related to DV, and then also to meet with clients who assert some of the protections that are specific to domestic violence and sexual assault. So for example, if someone asks for good cause for non-cooperation with the child support requirements because of domestic violence in the past, then the caseworker will probably try to set up a meeting with the DV specialist, both to go over the information that's required to request good cause, but also to see if there are any other services or supports that they can refer the client to. While the DV specialist can be helpful, one thing we like to stress is that people are not required to go meet with them. So we have several clients, we've had many clients over the years who have lots and lots of support in place. They already have an advocate from a shelter. They already have a therapist. They're kind of already hooked up, and going to meet with the DV specialist feels like just another requirement and not something that's going to be super helpful. and they should not be required to go. They can decline that appointment, and it should not have any negative impact on their benefits. So I just wanted to kind of flag that. Okay, so in terms of what you can do if you have clients who are getting DTA benefits or applying for DTA benefits, what I would encourage you to do is try to help identify situations where some of the protections that I talked about today might be appropriate. Mention them to the client, help them assert it with DTA if that's appropriate. And that can be done both kind of affirmatively or proactively, like thinking ahead, oh, this client seems to really be struggling with this. I'm going to see if, this protection might be appropriate. For example, it's clear that the client couldn't meet a 20-hour-a-week work requirement. And you might want to think proactively, what protection could we put in place? Would a disability exemption be appropriate here? If you don't have the time to be proactive, or it's too late, if the client's benefits are already reduced or have already stopped, you can also still check to see if her protection applies, and it may not be too late to help the client assert it at that point. It kind of depends exactly on the timing, but that's important to think about, and people always have a right to reapply. So even if they've lost benefits for not complying with a rule or something, they can still reapply and assert a protection at that point in time, okay? Another role that advocates can play is to help with documentation. I was saying before that some clients don't have a lot of third-party verification of what's gone on. They don't have a restraining order or court order, and they may need to use their own statement along with the statement of someone else. You may be able to be that someone else and write a pretty basic statement that helps to prove the domestic violence or sexual assault for purposes of what DTA needs. And then before I talk about referring to legal services, because there was a lot of people on the poll said that getting through to a DTA caseworker can be a big challenge. I just want to try to quickly address that. So what you can do there is really try to work your way up the chain of command. A lot of times DTA caseworkers' voicemail boxes are full and you can't even leave a message, but if you are able to leave a message, you may never get a phone call back. You might, but in many cases you won't. Some DTA workers leave their supervisor's name and phone number on their voicemail. They are all supposed to do that, but not all of them do it. If they do that, then go ahead and call that supervisor. If they haven't done that, you can try calling the main number for the DTA office and ask for, say that the worker is this person, I need that person's supervisor. If that doesn't work, you can call the main number and ask to speak with an assistant director for the office. So every local DTA office has caseworkers, supervisors, and then management. And the managers usually consist of an assistant director or 2 or 3, and then a manager. And it is absolutely fine to call the management about individual case problems if you're not getting a response from other people. So that's one way that you can, hopefully try to work up the chain of command if you're just not able to get through to an assigned caseworker. And then finally, another thing that I wanted to talk about is referring cases to legal services. And in the next slide, I have a little bit more information about which cases are appropriate. But for folks who aren't familiar, we have legal services programs across Massachusetts. The program that I work in covers the greater Boston area, but there are programs all across Massachusetts, and all of them handle benefits issues. So it can be appropriate to refer the cases to legal services. Ayana, can you move on to the next slide? So if you have a case where a TAFDC or EADC application is denied and you think the person should be eligible for benefits, that's a case that you can refer to legal services. Or if you think that the client either has already lost or is at risk of losing their TAFDC or EADC, those cases can be appropriate to refer to. It's always good to refer, certainly if there's already what's called an adverse action notice, which means DTA is saying we're going to do something negative, we're going to stop your benefits, we're going to lower them. That's always a point where it's good to refer. And then also, if you can proactively anticipate this client needs help asserting this type of protection, those are also cases that are appropriate to refer to us. In general, legal services likes cases where there's like a live legal problem. But in situations where it has to do with asserting protections that are related to domestic violence, related to disability, we kind of make an exception to that, and we like to be available to help people more proactively to try to ward off problems. And one thing I'll just quickly say in case we have folks who are in the greater Boston area, my unit, we take direct referrals from providers. So if you are interested in setting something like that up, you can get in touch with me and we can talk about that. We have a form that providers can use. It's very easy to fill out, and you can send the cases to us, and then we evaluate, is this something we can take or not? And it kind of skips the intake process. And we do that because we try to prioritize these types of cases. On the next slide, I do have, though, the more general information for how you find your local legal services program. And then the process for that usually is, if you don't have a direct referral kind of mechanism, is to have the client call or call with the client to an intake line where they do an intake and identify the issue, and then sort of gather the basic information that they need to figure out which legal services program to send it to and if it's appropriate to send and all of that stuff. And then I just noted on here also a couple other resources for you for dealing with DTA cash cases. There are these sort of books that are put out every year, updated every year, called advocacy guides. They are written by the Mass Law Reform Institute, and they're really, really great resources. They're very accessible. They're written in question and answer format. They're very easy to understand, and they're a good place to go if you think, like a little bell goes off and you think, oh, that sounds like one of these issues that we talked about. You can go and look at it for more information. There's a lot of good in-depth information, and you can download them for free at the website that's provided here. Okay, and then finally, I just wanted to mention one other thing and see if we can enlist some help from you guys. So I mentioned the family cap rule, which is a rule that limits TFDC for kids who are born after the family's already been on TFDC for a while. Greater Boston Legal Services and many, many other organizations, including Jane Doe, are engaged in a campaign to try to get the legislature to repeal the family cap rule, because it is a very punitive rule that has a lot of really negative impacts on families. And so we are trying to get it repealed. If you want to sign a petition supporting the repeal, there's a link here, as well as some other resources. We have a Facebook page. And then at the bottom, if you're interested in getting involved in kind of getting the updates that we send out periodically, there's a couple email addresses at the bottom for my colleagues, Naomi and Deborah. You could email either one of them and say, please add me to the list. I want to be involved. And that would be fantastic.
Awesome.
All right.
Thank you so much, Lisbeth, for doing that. It was really great information to know. And just to let folks know who are joining us, I'll be sending out these resources right after the webinar, so folks will have a hard copy to kind of like look through and make sure that they're following. And so we have a couple minutes for some quick questions before we go off into the next portion of it. We're going to limit it to 2 minutes. So if anybody has any questions, please put them inside of the group chat. First, we have a question. Is there a wait time to reapply to DTA benefits?
No, there's not. So one of the things that goes sort of, that we always tell people is people have a right to apply for benefits. It doesn't matter if you were denied in the past, even just denied. It doesn't matter if the person taking your application thinks you're not eligible. You absolutely have a right to apply for benefits. And, the only situation where I can see something like this getting misconstrued is if you have someone who reached the end of their TAFDC time limit and they're told that they are being cut off of TFDC because they reached the end of the time limit, then they may be told, well, you need to wait. And because the way the time limit works in Massachusetts is that the first time that you apply for TFDC, you have 24 months of time limited benefits within a 5-year period. When you get to the end of the 5-year period, a new 5-year period starts and you get another 24 months of eligibility. And so I could see a situation where someone's told, well, you're out of time now, but they call it a clock reset. Your clock is going to reset in a year and you can come back and reapply then. That's true if you're only thinking about the sort of time limited benefits, but if there's a potential protection available to that person, for example, if they might be eligible for an exemption, either because they care for someone who's disabled or they have a disability themselves, then they can certainly try to reapply sooner. So that's the only situation where I can see how that information could come about.
That's awesome. Thank you so much.
Yeah.
And there was a quick question to contact for Naomi. It's at the bottom of it. It's nmeyer@gbls.org.
Yep, that's it.
Again, you'll get these slides so folks will be able to have the different types of email addresses and different contacts.
Yeah. And Ayana, I just wanted to add one thing, which is that in the materials that you're going to send out, I put together two different kind of handouts for people. And one is called Welfare Rules Related to Domestic Violence. And that goes through a lot of what I covered today about these specific rules and how they relate. And then the other one is just a more general handout that gives basic information about SNAP, TAFDC, EADC, and childcare. And it includes more than what I covered today. So hopefully this will be just a good resource for you as well.
Yeah, thank you so much. I think I looked through those resources and they're really easy to read. So I appreciate that. Thank you. Awesome. So we're going to move into the next portion where we're going to have Linda Landry tell us a little bit about SSI benefits. Linda, thank you so much for joining us, and we'll carry on into your part of the presentation.
Thank you, Ayana, and welcome everyone. I'm Linda Landry at the Disability Law Center. I too am going to cover a lot very quickly. The Social Security programs are extremely detailed, and it's important to know that no matter how detailed I seem, there's a lot that we're not covering today. So as Elizabeth said earlier, we're really hoping to acquaint you with the overview of the benefits and some of the acronyms and spotting the issue things. So before I get into the benefits though, I want to talk about two specific domestic violence provisions that are important for people to know about. The first is getting a new Social Security number. It's not SSA's policy to give people new Social Security numbers as a rule. But if an individual needs a new Social Security number because of harassment, abuse, or life endangerment, including domestic violence, Social Security will work with them to get a new SSN. So that is really what's different in cases of danger and domestic violence. So you need your current SSN to get a new SSN. You need the usual pieces of evidence that you need to get an SSN in the first place, which is evidence of U.S. citizenship or work authorized immigration status and age and identity. And then if you're changing your name as well, you need evidence of that. And at the bottom of the slide, you can see a link to a Social Security publication which gives more detail on getting a new SSN. And I think it's English on one side and Spanish on the other. So next slide, please, Ayana. The other domestic violence specific policy has to do with protection of people's information at SSA. SSA is generally very protective of personal information, but now that a lot of their business is done online, they're very sensitive to the fact that people may need to block access to online information. So again, at the bottom of the slide, there is a link to a blog that SSA has on protecting your identity. And so what you can do is you set up an account through My Social Security, which is a function that is displayed on SSA's website very prominently, where people can create a My Social Security account where they can go and get information on their benefits anytime. But you can also block information to that information, although when you do, you won't have access to it either. So people can block and unblock as they need the information. Now there are still some paper files, although Social Security is really trying to get rid of all of them and not use paper files anymore. And they used to have a process in the past where they would flag domestic violence cases so that if somebody came in trying to get information, they couldn't if there was the flag on it. I'm not sure anybody uses that anymore, but in part because it's so hard to get anything through any Social Security office at all. Social Security's administrative budget has been underfunded for a very long time, and there's not enough people in local Social Security offices anymore to provide customer service in the way that they used to. So people, when people go into Social Security, they have to wait for a long time, and there's really a lot of security there. So I think it's harder to get access from information with paper files than it ever used to be, and they're more worried about people getting access through their online functions. But on the later slide, I will recommend that anybody working with domestic violence survivors as an organization especially, make yourselves known to the Social Security offices that serve your area. Let them know who you are and ask them how you can help them protect your clients and theirs. I think you'll find that many of them are willing, although it may take you a little while to get an appointment. Okay, next slide, please. So let's talk about the benefits now. So Social Security is a federal agency. It administers 2 cash benefit programs for elders and for people with disabilities. So the first one is the Social Security insurance programs called Title II of the Social Security Act, and you can see the section of the regulations there in case you ever need it. The second one is the Supplemental Security Income Program called Title 16 of the Social Security Act. And again, just a warning, these PowerPoints, although they might seem fairly detailed, really aren't detailed enough to know everything you need to know. People go to Social Security's field offices. There are field offices in every state. I think in Massachusetts we have about 10 now, where people go to file applications and file appeals. And again, because they're so busy these days, people need to know that if they go, even if they have an appointment, they need to wait. They're going to have to wait to see somebody. Social Security will assist with needed documentation when people are homeless and in other situations. And I've again included a link to the Social Security policy on when they will provide assistance with needed documentation. Again, because of the low staffing levels, it's sometimes hard to get the help that people need. So if you are working with domestic violence survivors, as Lisbeth said, it may be important for you to be able to at least begin to help them to get some of the documentation they need for benefits. And again, there's my tip. Try to reach out to the field office serving your area to learn how you can work together. It can really, really help pave the way for better service for your clients. Okay, next slide, please. So let's talk about the Title II benefits. This is that first program, the insurance program. It's not a welfare program. It doesn't have income and asset limits like welfare programs do. This is the program that was created at the end of the Great Depression back in the 1930s. The idea is you pay into this program by working and paying the Social Security taxes, the FICA taxes on your wages. And if you work long enough and pay FICA taxes long enough, you earn insured status for these programs. For most people, this means 40 quarters, or the equivalent of 10 years of work paying the FICA taxes to have insured status. Know that there is a lesser standard for people under age 31 so that they can be eligible if they've worked and paid FICA. You have to meet the categorical eligibility requirements, which are only disability and age. Depending on the program you're applying for. You have to be lawfully present in the U.S., which is a low standard. Again, the Title II eligibility categories are retirement, so full retirement age these days, which is when you get your full retirement benefit is between age 65 and 67, depending on your birth year, or 62 for permanently reduced retirement benefits. The one you're most likely to run into probably is Social Security disability insurance, which is available to adults age 18 through full retirement age. Requires proof of disability under a pretty strict disability standard. And again, these benefits are not needs-based. They have no income or asset limits. But for most people, if you work, there is an effect on your benefits. Not because it's a needs-based benefit, because at some point work may mean that you're not eligible for the benefit. Okay, next slide, please. There are also certain dependents and survivors of benefits that are payable to certain close relatives of either insured deceased workers or insured wage earners who are eligible for a benefit themselves, either Social Security disability insurance or a retirement insurance benefits. These include minor children of the wage earner who is receiving the benefit. So you may have a client who is a parent who receives SSDI, and her kids may be getting a benefit on her wage record just because they are her minor children. The abuser could also be the SSDI recipient, and in which case the other parent may be fleeing with the children who are getting benefit on the wage earner's wage record, which will mean you'll need to contact Social Security so that they know you have fled, and that they not give information to the abuser SSDI recipient about you and the children. And children receive benefits through a representative payee who could either be the fleeing parent or the abuser. Often it is the abuser if they're interested in control. And so you'll need to contact Social Security about changing the representative payee for the children. Can also be disabled adult children, parents caring for the insured's child is under 16, or widows and widowers. Okay, next slide, please. The Title II benefit amount, whether it's retirement or disability, is based on the wage earner's work and wage history. So workers with a longer wage history and higher wages get more money than lower wage workers. However, there's a cap on the benefit, and the maximum this year you can see in the bullet. It's $2,788 per month. So it's not an enormous benefit, and it's often less than that. And dependents' benefits are calculated based on a pot of money calculated on top of the wage earner's primary insurance amount. And so the fact that dependents are drawing on a wage earner's wage record never affects the wage earner's benefit. So that's an important thing to know. Okay, next slide, please. And Medicare is the health insurance that comes along with this benefit. It comes along with at full retirement age with retirement benefits. It doesn't come along with early retirement benefits until age 65. So it's an important thing to know about. It does come with SSDI benefits, but not for 24 months and not until after 24 months of eligibility, with just a couple of exceptions. People who have ALS or end-stage renal disease don't have to wait, but everyone else does. So people who get one of these benefits who only have Medicare often need to apply for Mass Health as well to get everything they need, because Medicare is like private insurance, and it has a lot of copays and deductibles and doesn't cover everything. Okay, next slide, please. All right, so now we're going to turn the corner and talk about SSI. SSI is a needs-based benefit. It's a lot like, it's a federal welfare benefit, essentially. It does pay benefits to many of the same types of people that Social Security insurance does, people who are 65 and older, blind children and adults, and blind and disabled children and adults. It is a low-income program. You have to have less countable income than what Social Security will pay you. And you have to have low resources, only $2,000 in countable resources for an individual, or $3,000 for a member of a married couple. And the good news is that Mass Health is automatic with any amount of SSI, which is pretty good insurance and certainly better than Medicare. Next slide, please. You have to be a resident of the U.S. and the state, and you have to be a U.S. citizen or meet very restrictive non-citizen eligibility criteria. And I didn't provide the link. I meant to do that, to the Social Security policy called the POMS on who's eligible as a non-citizen. Okay, next slide, please. The benefit amount is not personal to the individual. It's set every year by the federal government. This year, it's a maximum of $750 for an individual. And there are a lot of ways to get less. The way you determine what the benefit payment rate is to determine the countable income of the individual and deduct that from the maximum pay rate. There's also a separate state supplement benefit that's paid based on one's living arrangement. And I think on the next slide we can see that. Yes, so what they call full cost is $750 in the SSI benefit rate plus $114.39 in the state supplement. Shared living, which is what many people get when they are in shelter, or if they live with roommates, is $750 plus $30.40 in the state supplement. Again, these are the maximums. If you have countable income, that reduces it. Household of another is where somebody lives in somebody else's household and gets help with food and shelter-related items from within the household. So that's $500 in SSI and $87.58 in the state supplement. Now, that might apply to some shelters as well that aren't considered in the shared living, so you might see either one of those. And then there's the medical institution where people are in hospitals, living in hospitals, or in nursing homes. So that's paid as a personal needs allowance, essentially. Okay, next slide, please. Then it's important to know about the types of income. Earned income is income from employment. Only about half of gross monthly income counts to reduce the SSI benefit. Unearned income is not favored, and that's anything that isn't wages, including SSDI, alimony, pensions, inheritances, child support counts virtually dollar for dollar, except for children under age 18. A third of child support doesn't count. Deeming is when Social Security counts someone else's income to the SSI recipient. That could be a spouse, it could be a parent to a minor child. Important to know that when spouses no longer live together, deeming doesn't apply. Nor does deeming apply when a parent doesn't live with the child. So people who have left a domestic violence situation with the children, the abuser's income no longer counts to determine either of their eligibilities for SSI. And then there's in-kind income, which is when you receive help with food and shelter, which is why people who live in somebody else's household and in some shelters get less SSI. Okay. TAFDC and SSI, Elizabeth certainly touched on the rules for TAFDC. It's important to know that people who get TAFDC can also have an SSI eligible family member, and when that happens, the SSI recipient isn't included in the unit, so they lose the incremental of, for one person, about $100 on the TAFDC, but they gain SSI, which is tends to be a higher benefit, and the income and assets of the SSI recipient do not count to the TAFDC family unit. So that's helpful. We can do the next slide. And again, EAEDC is paid as an interim benefit to people who are trying to get SSI. So very low income situations, people can apply for EAEDC, which comes in more quickly. It often takes months or even years for SSI eligibility to be determined. And in the meantime, if the person is low income enough, they can receive EAEDC as an interim benefit. And when they win SSI, SSI will repay DTA for the EAEDC received while the application is pending. Okay, next slide, please. Resource eligibility, essentially almost anything that the individual owns and can access to pay their basic needs is a countable resource, including cash that isn't current month's income. And again, it's a very low countable asset limit, but when spouses do not live together, the assets do not count. The assets of the absent spouse do not count to the SSI recipient spouse. And the reason I wanted to talk about countable assets is, I think, on the next slide. Well, this cites the rule that you have to both own it or have an ownership interest in and have legal access to it. And cash or income remaining after the month you receive it, if you don't spend it down, becomes a resource. But what I really wanted to mention was that a non-countable asset includes a home that the individual owns or has an ownership interest in and lives in. So ordinarily, when you no longer live in the home, it's a countable asset. In domestic violence situations, if the individual no longer lives in the home, for that reason, you'll find out in a minute that it generally doesn't count as an asset. You can have one vehicle per family also that doesn't count regardless of value, earned income tax credits, some student aid, etc. It doesn't count. Okay, next slide, please. So here's a domestic violence specific policy about the home you don't live in. If you don't, ordinarily, as I said, if you don't live in a home that you have an ownership interest in, it counts as an asset, except when you leave your home due to domestic violence and have not yet established a new principal place of residence. So if you're couch surfing or living in a shelter, the home that you left shouldn't count as an asset. Next slide, please. And then even after finding a new principal place of residence, like you establish yourself in a new apartment, the home that you left may continue to be an excluded asset if the co-owner refuses to sell and you don't have the legal authority to sell it without the co-owner's consent. And you can see SSA's policy on this in the link on this slide. And I think there's also provision for people who are fearful of approaching the co-owner about selling or even getting evidence of their failure to consent to sell. Next slide, please. And some of the evidence you will need to establish that you left the home due to domestic violence are similar to some of the verifications that Lisbeth was mentioning that you might need for TAFDC. Evidence of seeking help from a domestic violence shelter or program, having a protective order against the abuser, or affidavits from any medical personnel or clergy, shelter managers, social services, or agency personnel. These are all included in this policy, which for some reason I didn't, at the bottom, the POMS policy that I didn't include the link to, but you can Google it. If you Google it, it'll come right up. And the list, this is the list that they include, but it also says it isn't limited to. So there may be other ways to prove that domestic violence was involved in the individual situation that would be just as acceptable as the ones that are listed. Okay. Next slide, please. I just wanted to briefly say this is a way that people get into trouble with SSI. You can always spend down excess income and assets to gain SSI eligibility, but you have to spend it down on yourself. You can't spend it on other people, and you can't give it away. You have to spend it on yourself and be able to prove that you did that with receipts. To do otherwise is to risk what they call a transfer of asset penalty, which is SSI ineligibility for the number of months that results by dividing the amount they think you transferred or spent down inappropriately by the benefit amount. So, and it's capped at 36 months, but any amount of SSI ineligibility can be a real penalty. And you can see the policy on that again at those POMs that I put in the bottom of the slide. Okay, next slide, please. And suspense versus termination is another important concept. People can be financially ineligible for SSI for brief periods, up to 12 consecutive months, without losing entitlement. The difference is once you've lost entitlement, you have to reapply. But when you're in suspense, maybe because you've got a few too many assets and you're working on spending them down, you're not eligible for your benefit when you're in suspense. you're not eligible for payment. But as soon as you prove to Social Security that you did spend down those excess assets or that excess income for fair market value by showing them the receipts and showing them you are again financially eligible, you can get back on without having to file a new application. Okay, next slide, please. And here are the reporting responsibility. It's really important for people who get SSI and SSDI to regularly report, first of all, how they can be reached. If social, and you want to get your address changed, you don't want your notices going to anywhere where the abuser lives. You want to make sure that they can send you notices where you are for safety reasons, but also so that you can respond to Social Security. If they send you a notice and you do not respond, they will stop your benefits because your whereabouts unknown. And it's also important to report any change that might affect your benefit amount, whether it's income or changing your living arrangement, no later than the 10th of the month after the month in which the change occurs, but really as soon as possible. And I say this because SSA needs money. Congress gave them money recently, but it was for accountability, which means fraud squads. And so people can be reported for fraud if they don't report on time, which is not something you want to happen. SSI recipients can also report wages by telephone wage reporting, which may be important. You have to get a little training from your Social Security office in order to do that, to do it right. And SSDI recipients can now report some wages through that My Social Security portal that I mentioned earlier, so you can do it online. And if you've blocked access to your online information, you can turn it back, you can turn it on to report and then turn it off once you're finished. Okay, next slide, please. Oh, and this is the last slide. This is just how to get more information. If you're a benefit recipient and you've fled an abuser and you have direct deposit that your abuser has access to, you're going to want to change that. And that Social Security has instructions on how to do that at this link that I have supplied. And I mentioned earlier that if you get benefits, you or your child, and the abuser is the representative payee, you're going to want to get that changed right away. And there's information on representative payment at the link in this bullet. And then there's just information that you might be interested in that you can find on SSA's website about applying. They have some getting started kits, changing your address, again, very important, tells you how to do that. There's My Social Security account you can set up. SSA has a wide range of pamphlets in fairly simple language and in languages other than English about eligibility and reporting and a lot of topics that are really useful to know about. They have a whole section on information for same-sex couples on what you're eligible for, when kids are eligible. And then just SSA's regulations and POMs for those of you who are policy wonks. And that's it. That's probably enough.
Awesome. Thank you so much, Linda, for all that information. And so now we're coming into the question and answer portion of the end. So if you have any questions specifically for Linda or also for Elizabeth, please put them inside of our chat box and I'll be reading them out to them so that they can answer as we go. I'm also putting out a survey link so that folks can please fill out the survey and write about what they felt about this webinar, what you'd like to see in the future. Are there certain benefits that you need more information about that we can link you to the folks who have those information? So there you go. Please fill out that survey link when you can. And so we have one question. If a client receiving both SSI and SSDI wants to work part-time, who should they contact to figure out how their benefits may change?
Well, that's a great question. And I didn't think to put a great resource for help on the slides, but I think I can tell you about it in a way you can find it. Definitely, you can try to go to your local Social Security office, but you might have to make an appointment and wait a long time to see someone. There are different work rules in the SSI program and the SSDI program. And so when you report work, you need to make sure you are reporting it to both your SSI worker and your SSDI worker if they are different. And when you report work to Social Security, they should mail you a receipt. It doesn't look like a receipt, it looks like a notice. But if what you're looking for is information on the effect of wages on your benefits, there is a free resource called Benefits Counseling, and there are two in Massachusetts. One is that serves generally the eastern part of Massachusetts, is called Project Impact. They're cited at Mass Rehab Commission, but they're separate, so you can Google them and find them. The group that tends to serve Central and Western Mass is called Benny Plan, BENEPLAN, all one word. It doesn't matter which one you call. If you call the wrong one, they will refer you to the right one. They get grants to work with people who receive SSI or SSDI or both, who are interested in working or already working, certainly working towards working, and they will provide information about about what you need to know. For SSI, it's easy though. About half of gross monthly wages affect the amount of SSI that you're otherwise entitled to get. Much more complicated with SSDI.
Awesome, thank you so much. We have another question for you, Linda. Are there categoric injuries / conditions that could overwrite the income requirements for SSI?
I was having a little trouble hearing you, Ayana, because of the sirens in the back, but I think I've got it.
Okay.
Any disability, if it's severe enough, if its functional effects on the individual are severe enough such that it severely impacts their ability to work on a sustained basis, can qualify. And Social Security has a series of steps where it goes through and figures out whether it's severe enough. There are sets of medical criteria called listings, which SSA presumes. If you have these medical criteria, you have functional limits that are seriously impacting your ability to work. So that's the most severe level of disability. And you can see those on SSA's website if you look for the medical listings. But that's not the end of it. They also have to do a more individualized review of the individual's actual medical evidence and their actual functional limitations, what those are. So less severe conditions can be disabling. The only thing that can't be, for which you can't get disability benefits, is alcoholism or drug abuse, if that is the only reason for the disability. It doesn't mean people who have drug or alcoholism going on can't be eligible for benefits, but they have to prove that there is something else that independently meets the disability standard.
Awesome, thank you so much.
Linda, can I jump in for 1 second?
Sure.
Because I'm not sure you heard the full question, which was, is there anything severe enough to override income requirements?
No, there's nothing severe enough. So for SSI, you have to meet the disability standard. You have to be income and assets level eligible, and you have to be a citizen or meet those restrictive non-citizen eligibility criteria. For SSDI, you have to have insured status.
Yeah. Thank you. If anybody else has any other questions, please put them through. Oh, awesome. So someone specified, yes, override is the word that they're
I'm with you.
Thank you, Elizabeth, for clarifying that.
Yep.
If anybody else has any other questions, they can feel free to put in the chat box. Otherwise, I will be including this presentation and the recording to folks, and the links are all in there. And so if folks can please fill out the survey, that would be the best thing for us so that we can learn how to better meet your needs. And so folks are asking again for the non-citizen requirements, and that was listed in the slide.
Ayana, may I say something still? The Disability Law Center doesn't do individual SSI and SSDI cases, but I am happy to talk to providers. And it's hard to talk about the SSI non-citizen eligibility criteria because they're really complicated. But if any of you are working with non-citizens and need to know that, please feel free to call me and we'll go through it. I'll give you what you need to know.
Awesome. And the same is true for the cash programs, especially for TAFDC and food stamps. The non-citizen eligibility rules are very, very complicated. And we have colleagues who literally spend a full day giving a training on this. In fact, I believe there actually is a full day training coming up.
You're right.
The basic benefits training that is done, organized by the Mass Law Reform Institute. Ayana, if you're Googling, if you Google basic benefits training in Massachusetts, it will come up, and there is a full day training on non-citizen eligibility for a whole range of benefits. And I want to say it's May 3rd, but I'm not positive, but it was snowed out. It was supposed to have happened already, and it's been put off. So if folks, are interested, that would be a great resource to look for. But just to say really quickly, the eligibility rules, non-citizen eligibility rules for the DTA programs, they're a different set of rules for each of their 3 benefits programs. So for TAFDC, EADC, and SNAP, different rules. So I can't tell you like one categorical rule, but I just want to echo what Linda said. These are hugely complex rules. The advocacy guides that I mentioned are a great place to start. But just like Linda said, at GBLS and other legal services are available to consult. We always tell people, unless someone is completely undocumented, if they are told they're not eligible because of their immigration status, it's a really good idea to consult with an advocate and see if that's correct or not.
Right.
Thank you so much. And so I'll make sure that we'll share out the basic benefits training as well, because you all have some really great resources that you've been working really hard with MLRI to put together, and they seem like they're really informative. So would you all be okay with me also sharing your emails so that folks, if they have really specific questions?
Yes.
Yep, definitely.
Awesome. Thank you. So thanks everyone for joining us. Thank you, Elizabeth and Linda, for sharing your knowledge. This is a really informative webinar. And a great place to start for folks to be able to kind of dig in deeper about what the different clarifications are between getting benefits. And so thank you all both for being here. I'll be sending out the webinar as well as these slides and resources for folks to be able to go back through them later on. If you all are joining us via phone or are concerned that you're not going to be able to get access to these slides or resources, please feel free to email me at ayana@janedoe.org, and I'll be able to connect you with them. So thank you both again so much for being a part of this. This is really great, and we really appreciate all your knowledge.
Thank you.
Thank you.
Bye.
Bye. Bye.